Welcome and thank you for your interest in this initiative. My name is Jilu Lin. I am a program officer at the NIH Office of Director, Division of Program Coordination, Planning and Strategic Initiatives, or DPCPSI, Office of Research on Women's Health, ORWH. I am program official for the Computational Modeling of Hormone Homeostasis Initiative. This initiative seeks to advance computational modeling of hormone signaling pathways and homeostasis, with an emphasis on applicability to sex-specific efficacy and toxicity evaluation of therapeutics. In this informational webinar, I will provide the background information about the initiative and walk through the research opportunity announcement for those who are interested in submitting an application. From the literature, we know that males and females differ in their response to therapeutics. Research has documented clinically significant sex differences in pharmacokinetics, dosing, treatment response, and toxicity. However, the molecular mechanisms underlying these differences remain unclear. These sex differences can emerge via a variety of mechanisms. Sex hormones interact with multiple systems and tissues, and changes in hormone homeostasis associated with puberty, fertility, pregnancy, and menopause can trigger systemic responses. Animal models are less reliable in predicting these nuanced human physiological responses. How sex influences biological processes relevant to therapeutic efficacy and toxicity remains a significant knowledge gap. The goal of this initiative is, therefore, to enable the development of computational models tailored to the complex female-male physiology, which will help generate the critical empirical support needed to evaluating the intervention's clinical benefit in a sex-specific manner. Through this initiative, the NIH seeks to advance our mechanistic understanding of the relationship between sex hormones and therapeutics. We envision that this initiative will be able to support a technological breakthrough where scientists can build a simulated multi-organ, multi-scale system that is able to generate scientifically and clinically meaningful predictions. We anticipate that this initiative will support innovative early stage and unique computational approaches. We encourage reuse of existing expansive knowledge base of human biology, which will help streamline drug biologics testing and propel bench to bedside translation. Ultimately, we anticipate the research supported by this initiative will help accelerate regulatory approval pathways and transform the development of safer, more effective drugs and biologics for both males and females. In the next few slides, I will walk through the specifics of the research opportunity announcement OTA 26004. You can visit the announcement on NIH DPCPSI website. For this initiative, the NIH may allocate up to $5 million per year for up to 3 years per award under this initiative. This opportunity is being funded as an other transaction or OT. OT awards are not grants, cooperative agreements, or contracts. They allow flexibility to adjust a range of activities, milestones, and deliverables based on the objectives and needs of the program. This means that tasks, partners, expertise, etc., can be added or removed based on the changing landscape. It allows NIH to negotiate substantial adjustments to the proposed work as best meets the objectives and spirit of the program. Many public policies apply to OT, though not Federal Acquisition Regulation or FAR or NIH grants policy. OT applications are required to go through an objective review. The NIH OT team develop the criteria of the review and the composition of the review team. Award funding is different from typical NIH grants. For example, OT allows for variable segment length. There is no future funding commitment, and there might be early termination or extension by the NIH depending upon the circumstances. The NIH intends to negotiate with applicants on the specific terms and conditions of the award. Additional information might be requested. There is no guarantee of funding until an official notice of award is issued. Changes in project and budget are also handled differently. For example, the NIH can propose changes beyond what was required in the research opportunity announcement, as well as establish unique terms and conditions that are customized for each individual award. Again, please visit the research opportunity announcement on the DPCPSI website. And in particular, please carefully review Section 2, eligible organization, for full details. Specifically here, non-domestic entities are not eligible to apply. Non-domestic components of the domestic organizations are not eligible. Foreign components, as defined in the NIH grants policy statement, are allowed. Higher education institutions, nonprofit, for-profit, and state and local governments, as well as tribal organizations, are eligible to apply. This opportunity involves a two-step submission process. First, a letter of intent, or LOI, is required. It must be submitted to the program email listed here, ORWH research@nih.gov. The due date for the letter of intent is April 24th, 2026, 5 p.m. local time of the applicant organization. The research opportunity announcement has full details of the components required for the letter of intent, and I will briefly mention here that the letter of intent must include a project summary and a table of key personnel. Again, please review the announcement for full details. Essentially, the letter of intent must clearly state what work is being proposed, why the proposed work is scientifically sound and significant, and who the team is. NIH staff will review the letter of intent for responsiveness and a likelihood of success. The research opportunity announcement provides the criteria the NIH uses for letter of intent review. By May 8th, applicants will be notified whether they are invited to submit a full application, but the NIH will not provide feedback on the letter of intent. Next, only applicants who have submitted the letter of intent and have received the invitation to submit a full application from the NIH are eligible to submit a full application. The announcement has full details of the components required for the full application. These full applications are due by June 8th, 5 p.m. local time of the applicant organization. Late applications will not be accepted. the applications must be submitted electronically through ERA Assist. In the next few minutes, I'll focus on describing the requirement of this opportunity, specifically what is and is not appropriate for this opportunity. This opportunity requires that the applicant develops any computational techniques that integrate biological data with mathematical representations to construct computer-based models and or simulations of human biology. A few examples of the approaches appropriate for this opportunity include kinetic and dynamic modeling, digital twins, multi-scale models, systems biological modeling, data-driven predictive models. The model or simulation must be mechanistic and must represent human biology or physiology. It must have clear relevance to the evaluation of therapeutics. For the purpose of this research opportunity announcement, such therapeutics may include drugs and biologics intended to treat, cure, prevent, or mitigate diseases, injuries, or conditions in humans. It also must have clear relevance to women's health. The applicant can focus on female-specific issues or conditions, or address how females and males may differ in a clinical meaningful way, or to put differently, account for sex as a biological variable. This research opportunity announcement calls for models strongly coupled with computational platforms and environments with artificial intelligence or AI, interactive machine learning, or natural language processing capabilities. The NIH intends to support innovative, early stage, or unique methods development rather than incremental extensions or applications of existing methods. The applications can draw from various data sources, such as experimental data, lab data, observational data, clinical data, tissue chip, or human omics data. Primary data collection is allowed, but such activity must be model-driven, meaning that the primary data collection is essential to model building, and without primary data collection, the model cannot be built. Correlation models, such as polygenic risk scores, are not appropriate for this opportunity. Research involving vertebrate or invertebrate animals is not allowed for this opportunity, and clinical trials are not allowed for this opportunity. Our anticipated final research outcome is described here. By the end of the 3-year period of performance, the model developed should demonstrate extensible foundational capabilities that effectively, accurately, and consistently predict sex-specific efficacy and toxicity of drugs and biologics. In the next few slides, I will walk through the data management and sharing plan as well as the resource sharing plan. So first, all applications must develop a data management and sharing plan in accordance with the NIH data management and sharing policy. In particular, scientific data generated under this initiative must be made publicly available alongside the resulting mathematical model before a formal patent application is filed. Such scientific data include primary experimental data, primary observational data, derived data from public repositories or from non-public sources, and simulation data. that are collected and generated as an integral part of model development and model performance evaluation. Delayed disclosure and data sharing for the purpose of evaluating the invention for patent application or filing a patent application is not allowed. If the data employed in the application have restricted access, the application must address in the data management sharing plan how access to these restricted data can be requested for independent model validation assessment purposes by third parties. Computational models are considered research tools. Therefore, applicants are required to submit a resource sharing plan in accordance with NIH Research Tools Policy. It is expected that the proposed model is developed with an architecture that will facilitate model sharing. Finally, this is an overview of the program timeline. Again, this opportunity has been posted on April 6th. Letters of intent are due by April 24th, 5 p.m. local time of the applicant organization. Only applicants who have received an invitation to submit are eligible to submit a full application. Full applications are due June 8th. We estimate that the negotiations will begin on or about July 13th. The earliest possible start date is September 1st. Thank you very much for attending this webinar. To review the research opportunity announcement, please visit our website. Frequently asked questions for this announcement will be available shortly on the DPCPSI website. Please check back soon. If you have additional questions, please email us at orwhresearch@nih.gov.